Assessment 3, Digital Media Assessment, Lung Cancer. The National Chronic Disease Strategy has been developed to provide national policy directions to improve chronic disease prevention and care across Australia. It is a nationally agreed agenda to encourage coordinated action in response to the growing impact of chronic disease on the health of Australians and our healthcare system. It seeks to improve healthcare outcomes and reduce the impact of chronic diseases on individuals, families, communities and society. The NCDS relates to patient care as its main objectives are to prevent the delay and onset of chronic diseases for individuals, maximise the well-being and quality of life of individuals living with chronic diseases and their families and carers, and implement best practice in the prevention, detection and management of chronic diseases. Jane is a 74-year-old woman with lung cancer, a history of COPD, asthma and acute bronchitis. Jane is a smoker, is in the low socio-economic status bracket, lives in housing commission, has no access to health services, has a poor diet and does not exercise regularly. Action Area 2, Early Detection and Treatment. Early detection supports early treatment, which can improve health outcomes by reducing premature morbidity, delaying the progression and complication of disease, improving quality of life and the ability to self-manage, and preventing or delaying admission to residential. Also avoid unnecessary hospital admissions and the high cost of complex treatments. Identifying and effectively implementing evidence-based and cost-effective approaches to early detection and early treatment will significantly improve health outcomes and quality of life of people with chronic diseases. As Jane is unable to access health services, she is unable to get the lung cancer detected and is also unable to get the treatment she requires to manage the lung cancer in the early stages. The first recommendation for early diagnosis and treatment in lung cancer is a low-dose chest CT scan. This was recommended by the National Comprehensive Cancer Network for selected individuals at high risk of developing lung cancer. The greatest challenge with lung cancer is catching it early enough to cure it. One trial, called the Randomised Lung Cancer Screening Trial, found very positive results with a relative reduction of 20% in deaths by lung cancer screening in high-risk individuals. Another recommendation for Jane is a lung biopsy, which can be used to assess the section of lung and assess if she has cancer. As Jane has limited access to health services, early diagnosis and treatment will be difficult. In saying this, the recommendations proposed would be the most appropriate in Jane's situation.